I'm sure we all agree this is not where we thought we'd be a year ago.
San Diego Fire Rescue Chief Colin Stoll is not seeing the high level of service promised by the city's ambulance provider, Falck.
This is not getting any better anytime soon. We're seeing the trends right now in the staffing, and I do not feel like anything is going to be corrected in the very near future if we just wait this out and wait for staffing to improve.
It's been just about a year since Falck fully took over San Diego's 911 contract. They provide emergency ambulance services throughout the city of San Diego. To get that contract, they promised more paramedics and EMTs, but data from the city shows they haven't once met their monthly staffing goals. This week's update to City Council focused on the months of July, August, and September. Falck San Diego's managing director, Jeff Boehm, says low staffing levels have continued hurting response times.
July, in terms of compliance, was very good. August became a little worse, and we saw September being one of our worst months of the year, next to January. And a lot of that certainly due to staffing, illness, injury.
Falck has already been fined $1.5 million, and the fire department says more fines are on the way. Falck says there's a nationwide shortage of paramedics and EMTs. Also, they admit recruiting has been a challenge, even after offering sign-on bonuses.
This ebb and flow is very obvious. The problem we have here is they are not competitive.
Anthony Sorcy is a 25-year paramedic, and he's also president of the union representing Falck employees. He says staffing shortages are forcing overtime, and first responders are burning out.
Our members share experiences of helplessness, mental anguish that has resulted in increased numbers of physical injury, illness, PTSD, and serious clinical depression.
Sorcy also says lack of staff has ambulances traveling all over the city, pushing up response times and even forcing the fire department to take their own measures.
These delays have resulted in critical patients being transported to area hospitals by San Diego fire engines because the fire crews could not longer wait at scene for an ambulance to become available for their calls.
City data shows the amount of time that no paramedic ambulances are available has risen since April. Councilmember Raul Campillo was not pleased with the lack of improvement.
I really just, I'm disappointed that we seem to be at a position where we can't provide our residents with what was promised to them. It's the same song again.
Councilmember Marnie Von Wilpert says she doesn't need to hear any more.
It seems that we have a pretty serious problem that this contract is failing.
Fire Chief Stoll is preparing for the worst. He commissioned a study to look into what it would take for the city to take over emergency medical services. Those options are set to be presented in January.
Whether it's an amendment to the contract or if we have to do some kind of a bond or takeover of the program or bring another company in to help, we need to do something.
Falck officials also maintain that one reason for delays is ambulances are being held too long at hospitals. They're getting some pushback. Scripps health officials say emergency rooms are busy, but data shows most patient drop-offs happen on time. Councilmember Monica Montgomery Stepp says, bottom line, no more excuses.
I just don't want to hear that anymore. We need to put solutions on the table, and I'm glad that we're going to be coming back in January with some potential solutions.
Falck is working with the city and other stakeholders on improvements. Falck officials say they remain committed to San Diego. Matt Hoffman, KPBS News.